Introduction to urinary catheterization. Introduction. Urinary catheterization is a procedure used to drain the bladder and collect urine, through a flexible tube called a catheter. Urinary catheters are usually inserted by doctors or nurses in the hospital or the community. They can either be inserted through the tube that carries urine out of the bladder, urethral catheter, or through a small opening made in your lower tummy, suprapubic catheter. The catheter usually remains in the bladder, allowing urine to flow through it and into a drainage bag. Depending on the type of catheter you have and why it's being used, the catheter may be removed after a few minutes, hours or days, or it may be needed for the long term. Why urinary catheters are used. A urinary catheter is usually used in people who have difficulty passing urine naturally. It can also be used to empty the bladder before or after surgery and to help perform certain tests. Specific reasons include: to allow urine to drain if you have an obstruction in the tube that carries urine out of the bladder, urethra, for example, because of scarring or prostate enlargement. To allow you to urinate if you have bladder weakness or nerve damage which affects your ability to pee. To drain your bladder during childbirth, if you have an epidural anesthetic. To drain your bladder before, during and/or after some types of surgery, such as operations on the womb, ovaries or bowels. To deliver medication directly into the bladder, such as during chemotherapy for bladder cancer. As a treatment for urinary incontinence when other types of treatment haven't worked, the catheter will be used until it's no longer needed. This may be for a short time and will be removed before leaving the hospital, or it may be needed for longer or even permanently.